evening I will be demonstrating on how to position or to transfer the patient from the bed going to the wheelchair. No? So for the purpose, no, so this is to transfer the patient, of course, with maximum safety and comfort for the patient. And for the assessment, you have to check the doctor's patient's record. No? So this is to check for the medical condition, the current problem of the patient, and the doctor's order indicating if there is any restrictions to movement flow. Alright? Next is that you have to assess also the endurance and capability of the patient. And lastly, you have to assess for the pain, if the patient is experiencing some pain. No? For you to know what are the restrictions during the transfer. Okay? Next, for the implementation, of course, you have to prepare all the materials. This is for smooth carrying out of the procedure. Do the hand washing and wear your gloves to prevent the spread of microorganisms. Okay? Next is that also this is for good infection control practices. Okay? Proceed to your patient's room, knock on the door 3 times for courtesy, greet, introduce, verify, and explain the procedure. So good morning, good evening, ma'am. My name is Joanne Maniago. May I know your name, please, ma'am? Miss Eliza. Okay, so for this evening, I will be assisting you to be transferred in the wheelchair. Alright? So next is that we will be of course, checking also the vital signs of the patient, so to know if the patient is in good condition, all right? And then I will be removing the top sheet first, all right? And then I will be placing or positioning the wheelchair 45 degrees on the foot part of the bed on the affected side of my patient. So again, since my patient is hemiplegia, her affected side is the left side. Okay? Don't forget to lock the wheelchair. This is for safety to prevent moving during the transfer, and also don't forget to lock the bed, wheels of the bed. Okay? So now, so slide one arm. So assist the patient first in a sitting position. So begin in the supine position. Ask the patient to scoop the bad leg, ma'am. Scoop the bad leg. Please scoop the bad leg with your good leg. Scoop mo, ma'am. Sige po. Yan. Okay, ganyan po yung scoop. Alright? And then I will be assisting my patient on a sitting position. So you can assist the patient on a sitting, or you can adjust the bed into a founder's position. Ayaw na.
Bigat kasi ni Ayla.
Ayaw na tumaas.
Namimili ng patient na.
Okay? To assume for a sitting position. Ayan. Ipaupo na natin siya agad. Okay, after that, put the patient on a lateral position. So dito na lang to, and then dito na lang. Ma'am, at the count of 3, I will be positioning you on a lateral position. 1, 2, 3, then side. Okay? And then I will be assisting my patient on a sitting position at the edge of the bed. How will you do that? You have to slide your arms on the legs of the patient and on the shoulder or back of the patient. At the count of 3, I will be placing you on the edge of the bed. 1, 2, 3, then sit. Nako ha? Next is that I will be asking my patient to scoot forward. No? So you have to move your good leg first. Ma. Good leg. And then push the bad. Good. Bad. Okay? And then allow the patient in this position for a few minutes. This is to prevent orthostatic hypotension. You have to let the patient dangle her feet. No? And then after putting the patient on a sitting for a few minutes, have the patient make sure that the legs or the feet of the patient is touching the floor. Alright? You can now offer slippers and gate gown. Okay. Next is that I will be asking my patient to grasp her hand, no? And then it should be bad over good thumb. So this is to prevent, yung bad mo. No? So this is to prevent what? Thumb injury. Diba? Sabi ko sa inyo, para po nasa taas si bad. Check the grip. Ma'am, hawakan mo mabuti. Check nyo lang kung hindi nyo matatanggal. Okay? And then put the arms of the patient around your neck. And as the patient stand, you have to, of course, stand erect and you have to bend your knees, no? To make a stance. And then you can do the knee to knee. Pwede po para maprotektahan yung masupport yung kanyang bad knee. Or you can sandwich the affected leg. No? At the count of 3, ma'am, I will be assisting you in a standing position. Please cooperate. Okay, hold on the gate belt. Okay? 1, 2, 3, stand up. And then move your good leg, ma'am. Followed by the bad, good, bad. Okay, and then put the arms of the patient on the wheelchair. And then you have to let the patient sit slowly on the chair. And you have to move backward. Good for good muna, then push the back. Alright? You have to make sure that the patient is sitting on the wheelchair firmly at the back, with the back seat of the wheelchair, and the patient is comfortable in the position. Okay? I will be asking my patient now to place the foot plates or the foot rest with your good foot. Sige. Scoop the bad leg. Scoop the bad leg. Alright. Okay, and then the foot. Okay? For privacy, of course, I will be placing a towel to provide privacy. So unlock the wheelchair. Excuse me. And then we're going to get the patient out of the... So, paalam niyo na kung paano lalabas. Diba? Sino ka muna? NA. Okay, pagpapasok. Alright, so kunyari nakapasok na tayo. Okay, so I will be now transferring my patient from the wheelchair going to the bed. So you have to, saan yung lalagay? 45 degrees on the head part of the bed. Ayan. Alright, so next is that, you have to lock the wheelchair, of course. Alright. Next is that I'm going to remove the back blanket. And then I will be asking the patient, forward mo pa ng konti, masyado malayo. Okay? So ask the patient to scoop the bad leg, ma'am. Scoop the bad leg. Okay, and then you have to fold the foot plates. Alright, and then ask the patient again not to move forward with your good leg first, and then push the bad. Good, bad. Alright, and then make sure that the legs of the patient or the feet of the patient is touching the floor. And then ask the patient to grasp the affected hand, and then top over good, bad over good. Check the grip again. Okay, and then you make a stance, and then you have to do the support the affected by doing knee to knee or to sandwich again the bad. Okay? Ngayon po, para po mabilis siya, kailangan mo unang mag-step yung bad niya. Okay? So, ang reason din kung bakit dito ko nilagay yung wheelchair niya is kapag tayo niya, kung sakasakali man na ma-out of balance siya, saan siya ma-out of balance? Sa base. Siyempre, doon siya sa bed. Okay? So, check. Sandwich ko na lang kasi parehas kami maliit. Okay? At the count of 3, I will assist you to stand. Please cooperate. 1, 2, 3. And then I will be moving your bad. Good. Bad. Good. Okay? Then sit down. Okay? And now, you will be moving backward. No? Scoot backward. Push the bad. Alright. You have to scoop the bad leg, ma'am. Scoop your bad leg. Okay? And then I will be assisting you on a lateral position. Okay, and then put the patient on a sitting position. Alright, and then we can now remove the gate. Then after this, you have to get the vital signs of the patient. Put back the top sheet, don't forget. Alright, and then you have to leave the patient comfortably. Assuming few minutes na ang lumipas, we can now put the patient on a sofa. Okay? Okay? And then just do the aftercare, remove your gloves, do the hand washing, record, and okay? The question po. Okay na.